Understanding of scoliosis in adults. Hey, Dr. Chris Scoobles here, and today I want to talk to you about scoliosis in adulthood. See, most people think about scoliosis in adolescence, and although that is a big concern, the reality is only about 3 to 4% of adolescents are ever diagnosed with scoliosis. Scoliosis is actually a much bigger problem in adulthood. That we know statistically that 10% of adults over the age of 40 have scoliosis. Once we hit 60 years old, it's 38%. So greater than 1 out of every third adult over the age of 60 has scoliosis. And at 90 years old, it's over 50% of the population has scoliosis. So when we look at adults, there can be one of two things going on. One, we could have a curve that was present as an adolescent or a child that is still there in adulthood and frequently becomes more severe and more painful in adulthood, which a lot of times is when it's first picked up or when someone may actually seek out treatment. Or we could have a new scoliosis that develops in adulthood. This is called a de novo scoliosis, meaning a new scoliosis, and this is a degenerative scoliosis. Now, both an idiopathic scoliosis that was present when someone was an adolescent, that is also or still present in adulthood, or a new de novo scoliosis, both of those can be a degenerative scoliosis. So when we look at why curves progress in adulthood, it's different than why they develop. When we get a scoliosis in adolescence, the spine actually grows asymmetrical. In adulthood, it's a degenerative problem as these curves get more severe. When you have an asymmetry of the spine, for example, if you have a curve of the spine, the inside of that curve is going to have more pressure on it than the outside. You're going to have more pressure on the disc, more pressure on the facet joints. As you have more pressure on those, the disc is going to start to wear on one side, and the facet joints are going to get arthritis on those. When that happens, you get more arthritis and the curve continues to progress and get more severe over time. When we look at these curves, the curves a lot of times get worse right around, like for women, right around menopause. So these curves are more common in women, and they tend to progress right around menopause. Now, with hormonal changes, that is associated with things like osteoporosis and osteopenia, and we think there's a direct contribution with the decrease in bone density and the increase or acceleration of the breakdown of the bones, which leads to an acceleration of the degeneration and the progression of a degenerative curve. So when we think about curves in adulthood and we think about degenerative scoliosis, we are also talking about arthritis, we're talking about degeneration of the disc, and those things also, along with the lateral bending and twisting of the spine, they lead to something called stenosis. Now, stenosis is a narrowing of a canal. You can actually get a stenosis of the vertebral canal itself, where the spinal cord and the nerves run down, and you can get a stenosis of the opening where the nerves branch out and go to the rest of your body. When you get a scoliosis in adulthood, a lot of times that puts uneven pressure, not a lot of times, it always puts uneven pressure on the disc, and that can lead to disc bulging and disc herniations, which additionally can put pressure on the nerves, opening what's known as the neural foramen, or the opening in the side of the vertebra. The nerves come out and go to the rest of the body. The most common reason someone goes to see a doctor as an adult with scoliosis is pain. Pain, although present in adolescence in many cases, it becomes more severe and it becomes the driving factor, the driving reason behind seeking treatment. So the number one reason adults seek treatment for scoliosis is to decrease pain. The second reason is to stop or slow progression. And then additionally, a lot of people would like to see improvements in their overall posture or alignment, and improvements in aesthetics if possible. When we look at adult treatments, there are surgical and non-surgical treatment options. There are surgical treatment options. That could be anything from like a discectomy. It could be a decompression surgery like a laminectomy, or removing part of the vertebrae to get more space around the spinal canal or the nerves because of that stenosis that forms up. Or you could get a spinal fusion where you're actually fusing vertebrae together to try and stabilize the spine. Now in adults, the surgeons may actually try to get some improvement alignments, but a lot of times the reason they're doing the fusions is to keep the curve from progressing. Here's what's interesting. The same goals for surgery, which is to decrease pain and stop and slow progression, is the same goal of non-surgical treatment options, custom bracing and scoliosis-specific exercises. When we look at adults, we can do scoliosis-specific exercises, things like Schroth, things like C's, scientific exercise approach to scoliosis, and we combine those with something called Scoli-Balance. We can also do custom bracing. It has actually been established in the scientific literature that scoliosis-specific exercises can slow the progression and in some cases even improve the size of scoliotic curves in adulthood. And a landmark study came out showing the effectiveness of custom scoliosis braces in slowing the progression of scoliotic curves in adults. In this study, they looked at a bunch of patients over time, and they found that the average patient with 10 years without wearing a custom brace actually progressed on average about 15 degrees. So over 10 years, most patients got 15 degrees worse without wearing a brace. That's 1.5 degrees per year. And then after 10 years with no brace, they gave the patients a custom scoliosis brace. And they had them wear that on average just 4 to 6 hours a day. And with wearing that brace just 4 to 6 hours a day, the curve progression reduced to just 0.1 to 0.2 degrees worse per year. Meaning over the last 5 years, on average, their curve only got 1 degree worse. So 15 degrees worse, first 10 years without wearing a brace, and then only 1 degree worse last 5 years with wearing a brace. So we know custom scoliosis braces are great at 1, relieving pain, and 2, slowing the progression of the curves. When we look at our patient population, the majority of our patients, probably 70 to 80% of our patients, are adults, frequently females, frequently between the ages of 55 and 75, that have painful degenerative scoliosis. As they get more severe and they get things like osteoporosis and osteopenia, they are not great surgical candidates because it's not a great idea to start screwing in a screw into a pedicle or part of the vertebrae when that vertebrae is already weak and more brittle. As you get older, the risk of severe complications goes up with age, so a lot of surgeons don't even want to operate on people as they get older. But if the goal of surgical treatment is the same goal of non-surgical treatment, you should always exhaust the appropriate non-surgical treatment options. The worst before you ever do surgery, because the worst thing that can happen with non-surgical treatment options, bracing and scoliosis-specific exercises, the worst outcome is the patient doesn't actually improve. They don't get the results they want. In reality, the worst potential outcome from a surgery is the patient doesn't wake up, or they're even more severe in pain and have more severe problems than before the surgery. So you always want to do non-surgical treatment options first. Now, along with treatments, you're going to need to incorporate some things into everyday life, some ergonomic things. And what we recommend is doing scoliosis-specific exercises that incorporate your exercises into your activities of daily living. But you also need to look at what other things you do in your life that could contribute to the scoliosis. If you sit at a desk, you want to make sure you have proper ergonomic setup. If you like to exercise, you want to meet with your provider about which exercises could make this progress. But the big thing, if you're an adult, you can spend a lot of time and a lot of money doing all kinds of treatments that can't do anything to impact your scoliosis long term. You need to make sure you get the most appropriate treatment. And if you have scoliosis, things like injections or radiofrequency ablation, they may give you some short-term relief to the scoliosis, but they are not, and I promise you, they are not going to do anything to impact the rate of that curve progression or to potentially decrease the curve. Scoliosis-specific exercises, custom bracing, those are your treatment options. You need to find someone that's skilled at what they do and knowledgeable and give you the most appropriate treatment so you have the highest likelihood of getting the best outcome. And then if those options don't work for you or you don't get to success, then you can always resort to surgery after non-surgical treatment options fail. Dr. Chris Scooble's here. Hope you find this helpful. If you're an adult or you know someone that has a degenerative scoliosis, they're looking for answers, refer them to this video, refer them to our office, because hopefully we can help them or you, whoever needs help.